Historic health care reform is now no longer a bill, it's a law. And in the next few hours, we're going to even improve the law. Among the biggest winners from this new law are America's seniors. This year, we'll finally start to crack down on insurance companies who think it's okay to charge someone a higher premium because they're old or because they have a pre-existing condition.
It phases out the donut hole that leaves so many beneficiaries vulnerable to high out-of-pocket costs for needed prescriptions, starting this year with a rebate check to help offset those costs.
That means a lot to me. I have personally seen seniors trying to decide between drugs or food or paying the bills. I worked at a pharmacy in Montana one day with a pharmacist and watched the seniors walk up to him and ask his advice. Should I take this drug, or is it that important? Or should I pay instead for the heating bill? It happens. It's very, very distressing to see it.
This will not only strengthen Medicare for today's seniors, but for their children and their grandchildren. It'll ensure seniors free preventive care, like annual physicals and checkups, and better care for chronic illnesses.
It will lower how much seniors have to pay for their medical care. According to Medicare's independent actuary, a typical Medicare recipient will end up paying less in Medicare premiums and copays, a combined reduction in out-of-pocket cost of about $700 a year. And as an internist, I'm especially pleased that the legislation helps ensure that Medicare patients have access to an internist or family physician of their choice by training more primary care doctors and increasing Medicare and Medicaid payments for primary care. Again, I'm so proud to stand with you today as the Senate begins the work of putting final finishing touches on legislation that preserves and strengthens the security that Medicare provides America's seniors, while extending this core principle to their children and grandchildren.
A great day, an important moment. But we'd be remiss if we just sort of congratulated ourselves and the organizations, because really what made this happen were literally the rank and file members of AARP and others that helped us get this job done. It wasn't just the fact that we had a good bill and good leaders, vitally important, couldn't have happened without them. But the fact that ordinary Americans decided enough was enough. That in this country, and I say this respectfully because I believe that an accused criminal ought to have the right to a lawyer. But there's something out of balance that if you're an accused criminal, you get to a right to a lawyer, but if you're a sick kid, you don't have a right to a doctor. That now ends with all of this. You get sick in this country, you're going to have a right to see a doctor. If you're an older American, that donut hole gets closed, so you can have access to prescription drugs. You're not going to be dumped by an insurance company. So thank you all very, very much for what you've done for our country. Don't ever forget this moment.
The AMA has been committed from the start to health system reform. We continue to be committed to that. We understand that this is not the end. It's a start, and it is a major start. We have a lot more work to do, and I want to assure you, Senator Reid, that the AMA is there to help with that work.
We need the Senate to act now and pass, without amendments, this final piece of health care reform legislation, which includes key priorities of AARP members and all older Americans, including closing the donut hole for Pat and for millions of older Americans.
This is not some political game that some of our colleagues are playing on the floor of the United States Senate. This is about life and death for a lot of people.
These changes are long overdue. But at long last, they're here.
Now the American people have something.
Yes.
They have guarantees. Yes. They have guarantees that you can't have your policy rescinded if you get sick. They have a guarantee that your kids will be covered even if they have a pre-existing condition. American people now are guaranteed that their kids can stay on their policies to their age 26. Yes. These guarantees are not a promise. They are part of the law right now. And we are not going to let them take it away from the American people.